All right. Hello. My name is Jake.
Hi, I'm Samantha.
Hi, my
My
name's
name's
Gannon.
Matt. Oh,
Ooh, my name's Gannon.
And my name's Tessa.
And today we're going to talk about radical belonging. So what is radical belonging? So to me, radical belonging means that every single member of the healthcare team can come to work and can be themselves. And every member of the team values what every other member contributes. So radical belonging is kind of a collaboration of different types of belonging. This can include social belonging, so really who you are as a person is accepted. It can include academic belonging. This means that what every member of the team brings academically, so whether you're a nurse, you're like extensively trained in these duties, or you're a doctor, or really every medical member, what they bring is valued. And also democratic belonging, meaning that every member of the team has a say um, in what should be implemented. Um, so as far as radical belonging, so it does involve diversity in that you want to include people of all different types of socioeconomic statuses. However, it's more than just about diversity. It's also about inclusion, which um, involves impacts. So there's actually studies that have been done that show that companies that are ethnically diverse actually do perform better. They perform up to 33% better. And workplaces that foster diversity have 24% higher revenue growth. It is important to know that something really makes America unique is that it is a melting pot of many, many different cultures. And we actually are predicted to be a minority majority company by 2025, which is why inclusiveness is so much more important.
Okay, so why are we talking about radical belonging even though we're all in different healthcare specialties? Really, it's because healthcare, it cannot be emphasized enough that it's a team effort. And ultimately, if it's not a safe or friendly workplace environment, it's detrimental to patient care. Because at the end of the day, regardless of specialty, whether it's pharmacist or physical therapist, nursing, any member of the healthcare team, it's ultimately for the goal of the patient, and it's for them. It's not for us. However, if there is kind of this workplace strife or this like unfriendly work environment or even hostile work environment, it's going to lead to sloppy mistakes and a lot of people not wanting to come to work, a lot of people calling off, or a lot of people just switching jobs. So really, that's why it's so important. And then we can't really talk about this like presentation without at least mentioning the SARS-CoV-2 pandemic, because during 2019, 2020, and even now, but prior to the development of the vaccines, it really put a strain on the healthcare industry. Governments across the world were not prepared for this pandemic. And many of us can recall that there was a shortage of PPE. It was a really scary time. There was a lot of uncertainty, and it really put a lot of stress, not only on the healthcare system, but governments as well. So from that, like, what can we learn from COVID-19? Why? Because it really brought to light a lot of the gaps in our public health system. A lot of areas were kind of brought to light where there's a lot of room for improvement. It sort of brought to light the inequities and disparities between people of different socioeconomic statuses. There's a lot of disparities in terms of access to who got the vaccine, depending on their age, depending on where they lived, depending on if they lived in cities or more rural areas. And it also brought to light how some people had the luxury of working from home and some people didn't. And often those people worked in more direct service industry jobs like cooking, cleaning, and they were exposing themselves to COVID, and then they had to go home to their families who also got COVID. So I think, Gannon, you want to add to this?
Yeah, absolutely. So as Samantha was saying, COVID-19 placed increased stress on the frontline workers, and this stress seemed to impact different people, and there is inequitable impacts. So for people on the front line, there was maybe inadequate resources for PPE, there's inadequate protection, there's stress, there's uncertainty, and these stresses seem to impact different members of society differently. There's also increased issues about safety. Workload was increased as members of the healthcare team were out sick, and this fueled concerns for burnout. There's decreases in mental health and other sorts of issues as well. And this was highlighted with the COVID-19 pandemic.
So we wanted to highlight a case in which we could see these stressors from the pandemic leading to some discrepancies within the radical belonging that someone was feeling. So we have Kadra, who came over to the US from Kenya. She initially, she's a family medicine trained physician who initially wanted to be the doctor because she had an infected hand that ended up being treated at a refugee camp. So she decided to pursue a medical career. She has been a medical physician for 10 years now, and during that time has acquired many different experiences that not only through her being a physician, but also having come from Kenya, she's been able to experience many different inequalities, both personal and observational. Recently, and related to COVID, she's had 2 uncles that have passed away from COVID. So she has a very deep connection to this pandemic that a lot of people are having to experience. On top of that, she's experiencing a very stressful environment with the influx in patient cases and beds being taken up in the hospital. She has to allocate more personal resources to treating these patients, documenting for those patient interactions, allocating resources. It's a lot for someone to have to handle. And throughout this case, we can notice that, okay, her personal relationships are becoming more strained. Her interactions between her and her team have been impacted. And she's managing a pretty large team. I think it mentions 2 registered nurses, 2 nursing assistants, a pharmacist, a unit clerk, a social worker, an environmental service staff member, administrative staff members focused on quality control. That's a big group of people that she has to monitor on top of patient care. So it's not surprising that she's missed several team meetings recently and has been observed to be less patient, more distracted, sometimes irritable. These are all just examples of how her work life has taken a big, taken over more so than her personal life. And kind of to round it all out, she's been experiencing some fright due to how angry and opinionated some of her patients and team members have been about some of the social and political matters that have come up secondary to this pandemic. And she no longer feels safe sharing her beliefs with the team, which to function as a team, you have to be able to collaborate ideas effectively. And if there's a disconnect between that transmission, you're obviously going to experience a lot of issues. So this is significant, but we're able to help her with that. And Tessa's going to talk about that next.
So we were considering some interventions for Kadra and kind of what she's going through right now. And the 3 that we chose were for her to have a scribe to address those mental health problems that she's experiencing and request support. To kind of further go into each of these, for the scribe, so with the pandemic, Kadra has had to increase her time documenting and charting as a result of the increase in cases from the pandemic. And because of the increased time documenting, Kadra has had less time to focus and tend to her patients. And so we thought that having a scribe for Kadra would help to decrease her time charting and increase that time she's able to spend with her patients, and then in return, improve that overall patient care. For addressing her mental health, considering the events that have occurred within the last year and the distraction that the pandemic has brought, we believe that Kadra would really benefit from the help of a mental health specialist. This would promote her own health going through such strenuous changes, as well as address those feelings of fear regarding the recent changes she has seen in her patients in regards to their political opinions and other opinions that Matt had mentioned. She has also, like Matt mentioned, felt this sense of disconnect with her team. So in these meetings with the specialist, that's something that she could address and maybe work through and find ways to reconnect with her team. Lastly, so with Kadra's extensive career in the medical field and having that 10 years of experience, she may also be able to advocate for herself and request that additional assistance when she feels it's needed for her and for her team. And then with that increased support, this could also benefit her mental health as well, which is something that we obviously wanted to address.
So as far as recommendations to support radical belongings, so typically we do think of single-mindedness as a negative thing. But I think when we think of inclusion, we want single-mindedness as in really focus on inclusion. As far as things that can help staff. So it's not just enough to, I guess, have like these resources open to everybody, but we really want to make sure that people know how to use them. I think a really great example that I read is that the idea of office hours in schools. So every school has office hours, but every professor has office hours. But depending on people's level of socioeconomic status, where people grew up, not everybody knows how to use office hours correctly. And this can really disproportionately affect students of color. And so I think the same idea really applies to people who work in healthcare, is that it's not enough to really just have like an office of diversity. You really want to make sure that everybody knows how to use this office of diversity and everybody knows how to get the proper resources.